At the end of 2007, blacks accounted for half, 46% of people living with the diagnosis of HIV infection.
In 2006, blacks accounted for nearly half, 45% of the new infections in the 50 states, as well as District of Columbia. In 2006, black men accounted for 2/3 of the new infection.
In 2006, the rate of new HIV infection for black women was nearly 15 times as high as that of white women and nearly 4 times that of Hispanic Latino women.
By the end of 2007, an estimated 233,624 blacks with a diagnosis of AIDS had died in the United States and 5 dependent areas. In 2006, HIV was the 9th leading cause of death for all blacks and the 3rd leading cause of death for black men and black women aged 35 to 44.
Many at risk for HIV infection fear stigma more than knowing their status, choosing instead to hide their risk behaviors rather than choose to seek testing and counseling.
The Center of Disease Control, CDC research, has led to new interventions that reduce risk for HIV in African Americans. The research has led to programs such as Community Promise, a community-level intervention, also Sister, informing sisters on topics about AIDS. It takes a village to fight HIV, so get tested, get educated, get involved.
At some point in their lifetime, 1 in 16 black men will be diagnosed with HIV infection, as will 1 in 30 black women. Get educated.
HIV transmission through the sharing of unclean needles.
CDC research has led to new interventions that reduce HIV risk in African Americans. Get involved.
In 2010, CDC announced a second 3-year expanded HIV testing program that supplements an initiative started in 2007 to increase HIV testing among African Americans. To get educated, one of our lacks is the education about HIV, to eliminate the myths that we have as a people about HIV education. If we know some stuff, then we can do some stuff. Better educate ourselves and better protect ourselves. Right now, African Americans are being infected faster than anyone else, especially in African American and Hispanic female between the ages of 14 to 45. 14 to 25 has the highest infection rate. So let's get educated. Let's understand what's going on with this dreaded disease.
CDC is working with African American leaders from every sector to mobilize communities of color against HIV and deliver culturally appropriate campaigns and messages, including the Act Against AIDS campaign. So get tested, get involved, get treated, and get educated, because it takes a village to fight HIV and AIDS.
By the end of 2007, an estimated 233,624 blacks with the diagnosis of AIDS have died in the United States and 5 dependent areas. So it's important that you get tested, get educated, get involved, and get treated. And by all means, remember, it takes a village to fight against HIV and AIDS.
From 2005 to 2008, the rate of HIV diagnosed among blacks increased from 68 per 100,000 persons to 74 per 100,000. This increase reflects the largest increase in rates of HIV diagnosed by race or ethnicity. We urge, get tested, get educated, become involved, get treated, because we know it takes a village to fight HIV, and together we can do it.
Center for Disease Control works closely with state and local health departments and community-based organizations to effectively utilize current HIV prevention interventions proven to be most effective for African Americans. Get tested, get educated, get involved, and get treated, because remember, it takes a village to fight HIV and AIDS.